Hi, everyone. Welcome back to the Doctor and Duo podcast, the podcast where we give you honest, unbiased feedback about medical school and the medical application process from the formerly average pre-meds to the now average pre-meds. My name's Eleni. I'm a third year now, which is kind of scary at the Penn State College of Medicine. And as a reminder, I speak only for myself and not for my institution.
Yeah, hey everyone, I'm Noah. I'm now also a third year medical student at Mayo Clinic, Alex School of Medicine. And just like Lenny, I only speak for myself and not my institution.
Great. Well, I know it's been a few months since the last episode. Unfortunately, both Noah and I have just been very busy with clerkships. And we kind of wanted to talk to you guys now that we're about halfway through our clerkships. At least I am. I don't know how far you are, Noah. But I'm about 6 months into my clerkships. I'm about halfway through. And I think I have a lot more feedback to give than last time. How do you feel?
Yeah, I feel about the same. I'm about halfway through. So I've done, let's see, four now. So yeah, exactly halfway through. I'm in the middle of my fifth. So we're slowly getting through it. As crazy as it is, we're like closer to being a doctor than we were a pre-med. So
I know. We're also closer to being 30 than we were when we first met in high school. And I think about that sometimes. But yeah, so I've done internal medicine, surgery, and family medicine. I just took my family medicine shelf, so I'm not going to give too much feedback on that end. But I've done kind of like the big three for Penn State. So those were the big three 8 week rotations, and now I'm beginning on my 4 week rotations. Noah, which rotations have you done?
Yeah, so for us, I chose to not start with some of the bigger ones. And so for us, family medicine was 4 weeks. That was my first rotation. Then I went on to do pediatrics, which was a little longer at 6, OB-GYN, which was also 6. Neuro is our shortest at 3. And now next week I'm in, which was my fifth, is psychiatry, and that's also 4.
I wish I had 6 weeks for OBGYN. I have four. Yeah, so I think my biggest takeaway from all of this is I didn't realize how polished that I would start being. That my presentations were and notes were just consistently on point all throughout family medicine. And I think it's because I went through such a rough patch. I think primarily for me, internal medicine, which was my first rotation, I think I really kind of crawled on broken glass so I could run
Yeah.
in a sense because I feel a lot more confident. I think going to my last half of rotations.
Yeah, I think for me, I think what's been shocking is since I've seen, and you've done 3, so you've done quite enough, but I think having been through now almost 5 rotations of just how different each specialty of medicine is and the little nuances between presentations. I actually agree with you. I think family medicine and internal medicine are the same in the sense that you see a little bit of everything, and also it requires you to really think about how you organize the patient's complaints and your assessment and your plan. And that really has helped me going forward in the sense of what is really like a good one liner that summarizes the patient? How can I phrase my assessment and plan? And that just helps for every rotation going forward. But then things change, like for peds, you might include developmental history, OB-GYN, your G's and P's, psych, your past psych history is might be important in your one liner. So those things change. But I agree, having like a good initial foundation really like helped me set me up just like you.
And I think kind of the biggest thing for me that was shocking about reaching the 6 month point in rotations was actually that I had free time to like do things. And I think my biggest dread and my biggest fear kind of coming into rotations was, oh my gosh, I'm not going to have enough time to, go to the gym or go home and see family or spend time with friends. And I know, Noah, in your case, you're engaged, so spending time with, your fiance. And I think that not only do I treasure the time more that I do get, but like there's actually pretty like there is time and you can carve that out. Like I think family medicine, I saw my friends at least once or twice a week, every week. And I think that was really nice and kind of really unexpected. And I think that was so important for me, kind of getting through this half year of rotations to have that support system.
Yeah, I think it's so interesting because we're always told that we have so little time in medical school, but the reality is time is what you make it. And I think at the beginning, like with everything, there's an adjustment. Sure for you on internal medicine, you might have spent maybe even like a few hours each night, like pre-reading on your patients. And like I have to have the perfect like presentation so I can be efficient during the day. And then as you go through rotations and as you build up confidence, you start to have a little bit more and more time. You get a sense of how you study and you know what the shelves are like. And then yeah, I've also been pleasantly surprised at this halfway mark. And I think being on psychiatry has helped because it's a little bit of an intense rotation. But I have more than ample time for myself to go to the gym. I can see friends when we're able to. Take time for self-care, and that's just something that's so important because even though we're not making the huge big decisions yet, like we will in residency, it still, can be a little draining, like coming home after a day. So I agree.
Yeah. So I think speaking of shelves, I think that the number one takeaway I had is you got to do UWorld. And you got to find time, and there is time, kind of between patients and on rounds, between rounds, or what. Don't have your phone out doing UWorld on rounds. I misspoke there. But I think there is time, and you kind of have to find it. And the people that are the most successful in their shops tend to be the people that get through all of UWorld for that subject, and can supplement it with additional resources. I found like case files for family medicine to be really helpful for me. I know a lot of people use online med ed, which unfortunately is now paywalled. Behind a quite expensive paywall, but I think like prioritizing getting through UWorld is really like the biggest challenge and the hardest like learning curve at the beginning, because I found myself coming home from my internal medicine rotation like exhausted. Like I'd been on rounds for 3-4 hours. Like when I was on infectious disease, I think we rounded like 6 or 7 hours in one day. It was crazy. But like how do I find that discipline to come home and sit down and not just do 25-year-old questions, but also review that what I got incorrect.
Yeah, I think that's the biggest thing. And I think, in the preclinical portion of med school, you can put a lot more emphasis, certainly before step one and dedicated, a lot more emphasis on memorization and just getting through the most amount of content possible. On your rotations, that's not possible. I think learning, especially for me, when it was UWorld, and then learning about my patient's conditions, like for me, like I would set out a certain number of UWorld questions to do a day and give myself time to, like Eleni said, review the incorrects. That's really important because you can't just mindlessly do UWorld questions like you could mindlessly do Anki. It's like very different. You have to really like pay attention. Like, why did I get this wrong? What's the clinical reasoning? And then also just taking the time. I think a good form of active learning is, and it helps you for your presentations and throughout your day, is like if you have a patient with heart failure, read the up-to-date article about heart failure, or Case Files in Family Medicine was a great resource. I think Case Files is like
Yes.
one of the best. Family Medicine was one of the best, but for every clerkship, there's pretty much a Case Files for almost every rotation, and that was helpful. So I think that's been the biggest change of like really taking charge of your own learning and like the individualized aspect that's necessary for your patients, and then also like Lani said, like it's really more the dedication and the discipline to make
Yeah.
sure that you have the time and that you make the time because you do have the time to do UWorld. Like on OB-GYN, like when I was waiting between OR cases, have the app on your phone. And while you're waiting for the patient to be rolled in, do five UWorld questions or whatever. So like Eleni said, there's definitely the time and it's really about the discipline, really.
Yeah. Yeah. It actually was an enjoyable experience for me. I think that, and we talked about this in our last video, but I think particularly now, right, having done this for half a year, I think that the buildup of clinical self-confidence is huge. I think that I feel a lot more self-confident, expressing my own differential diagnoses and examining a patient and conversing with a patient, right, about medication options or whatever that might be, because it's not just playing doctor anymore. I think at this point, you're starting to really actually be a part of the team. You may not have that on your first rotation. I did not feel that way when I was on internal medicine, for the first time. But I think now I really do think that, attendings actually take what I say seriously, right? I was actually in family medicine clinic this past week, and not to toot my own horn here, But I was listening to a patient and I felt confident enough in my cardiac exam. I said to the attending, hey, this doesn't sound right to me. And she didn't really hear it, but she said, hey, let's run an EKG. And we actually did end up finding sick sinus syndrome in this patient. And so, kind of being able to kind of confidently present yourself to the attending has been a huge change.
Yeah, I agree. I remember like giving my first presentation and you're like, Mr. So and so is a 60-year-old male who presents for like whatever the chief complaint was, and you as you meander your way through the physical exam, listing every physical exam finding, even if it's not pertinent. And then now to where you can like you take a history, you know, at least you have more of a semblance of an idea of what's pertinent and what's not. You know what are the key elements of the physical exam that the attending is looking out for you to say, and not necessarily what um, you know, is the standard version that you learn in like year one and year two of medical school. And then, like you said, it's really, I think, really the biggest change for me at 6 months is really like, what do I think? Like now, like like before I'd be more focused on like the resident would help you out. Like, here's what I'm thinking about, or here's what, like the attending might ask you about. And now it's more of like, what do I think the patient has? What do I want to do? Like it's more putting yourself in that role in 6 months when we're on our sub internships. We will. It's like, what do you want to do for the patient? What is your assessment? And it's really just getting in that habit of pretty soon I'm not going to be able to be like, oh well, this is what it could be this. I'm going to have to put my foot down and say, this is what I think it is. This is what I want to do, and then like adjust as necessary.
Yeah. I'm sorry, no, I feel like I've been asking all the questions and kind of driving the conversation. Anything that you wanted to bring up or ask?
Yeah, let's see. I think one thing that people might be interested, what has been the hardest part of adjusting to like, let's say as you switch between internal medicine and surgery and family medicine, what's been like the hardest part between switching? Just like different people? Has it been the presentations, the patient population?
Honestly, for me, it's adjusting to the schedule. Because I think that you kind of develop a methodology to how you do things by the second week of any rotation. And whether that's how I go to the gym or how I incorporate UWorld or how I'm like doing meal prep, right? Even something that basic can take a little bit of while to adjust to on each different rotations. And for me, I think this has probably been the experience for you, know, having known you for a while. I don't necessarily think the personalities are an issue. Knock on wood, I usually get along with pretty much everybody on my teams. I kind of figure out, hey, this is the culture of whatever this rotation is, and kind of try to mesh with whatever that might be. Um, and I found wonderful mentors on every single rotation. Wildly different personalities, for sure, going from internal medicine to surgery to family medicine. But I think honestly, it's the schedule. And like surgery, the schedule was terrible. I'm going to be very frank. I was on surgical oncology. I don't know if we talked about this in my last video, but just it was very tough adjusting to like 10, 12-hour surgeries with very little breaks, kind of coming in at 5 a.m. to pre round and then rounding again, and then going to surgery and then maybe having to round it again with the attendings. So the schedule was very challenging for me because that was like a 5 a.m. to 6, 7 p.m. schedule. But I think by the second week, I had said, hey, this is what I'm going to carve out my time for you world. And this is what's feasible for me to do, what's not feasible for me to do. So I think that was a challenge, but I had adjusted to it. And then it was like, okay, next service, it's like I got to readjust. How about you?
Yeah, I would agree. I think that's the hardest part. I think, and it's not really like you said, it's not really like the personalities for the most part. And I know there's a lot of doom and gloom on Reddit about attendings and resident dynamics. But I will say this, for the most part, you should have a good experience. And I think like, most people are there to teach you, most people are there to support you. Um, I've also been very fortunate, and then all my team members, residents, and attendings, other healthcare professionals, have all been like wonderful to work with. I think what can be different though is like the workflows of the team. I think, and just getting used to the different dynamics. Like some people are like they're very friendly and talking, like especially if you're in a more of like resident centric, like they all know each other, and then like you move and you're working directly with a one-on-one attending and they're not like very teachy per se, and you just have to learn, okay, this isn't the time to ask like 20 different questions. So I think it's really just adjusting to different team workflows. And like you said, you get used to that like within a week or two. But I think that's the hardest
Right.
part. You finally get a flow and then you move.
Right.
Just
Right.
sucks.
Yeah. Yeah, no, but I think it's good. I mean, it teaches you flexibility and kind of what works for you in developing, a study plan. So,
Yeah, definitely for sure. Um, I think like the flexibility is a big part. Like, I think what students need to keep in mind is like flexibility is key during third year, not only when you're switching between teams, you're studying for shells. Like there's a lot of change. Third year is the year of change. Like your
right.
first years are pretty stable. So that can be very different. I'm one of those people who likes stability. I get in a workflow, I want it to stay the same. Like, that's just me. But you get used to it. It's honestly, it's fun. Like third year has been surprisingly fun. It's busy, the hours can suck at times, but I feel like it's so much more engaging. You're actually taking care of patients. Um, it's a lot of fun, and you have fun along the way. You meet so many neat people from both your patients, and you're talking about what they do for a living or um their hobbies, and you find some sense of connection to the attendings who's like, oh yeah, like we go to that same like we go to the same gym, and and you
Yeah.
find it that way.
Yeah. Um, I get a lot of also random unsolicited advice from attendings too.
Yeah. Yeah.
So, sometimes good and bad. Um, but yeah, I think that I think the biggest surprise for me and the biggest takeaway, from all of this is that I did not expect it 6 months that I would really start feeling like an actual doctor. And I think that was something that was good and also something kind of scary because you feel like you're growing up.
Yeah, you definitely do. You start for in our case, we had a year and a half preclinical curriculum. So you literally start as like a baby year two, and now
Pretty
here,
much, yeah.
yeah, pretty much. And then by where we are now, I have like a good item on my differential. I can confidently state what I think, even if I'm wrong. And that's okay. Like you're gonna be wrong. Like you're a medical student, you're gonna be wrong as a third year, you're gonna be wrong as a fourth year, you're gonna be wrong as an intern. Sometimes you'll even be wrong as an attending. But at the end of the day, medicine is a judgment call.
Yes.
And you have to make a judgment. And that's really like the hardest part of and getting people to trust you is like, even if you're wrong, at least be able to explain your reasoning as to why you got the way you are. And that's honestly more important than the right answer in a lot of places. And that's what being a doctor is. It's reasoning about your way, making a judgment, and then sticking with it, and then changing as the data changes.
Yeah, I think that was my big takeaway from family medicine was I think the true beauty of it all is sometimes needing to know when to let things go.
Yeah.
Um, right, not even just with your patients, right? If they have six comorbidities, I can't talk to you about all of them. Sometimes we got to let some things go today, and we'll talk about them next time. But I also think it's about letting things go from a personal and professional perspective as well. Kind of, what's important to you, prioritizing what matters, and sometimes letting things roll off your shoulders. Um, you know, so I think that was a big lesson for me.
Oh, yeah. Speaking of family medicine, since we both experienced family medicine, you're sort of talking about letting things go. I think another big lesson, and I think it's hard to learn as students because a lot of times patient comes in and you want to give them the space to like express their concerns, but at the same time you have a job to do and you have to collect all this information and be in a timely manner and not ruin your resident or attending schedule.
Right.
But I think the biggest part for me, just not in medicine, but in life in general, is learning how to set boundaries. Being like at the beginning of an encounter, saying like, "Hey, I have like 30 to 45 minutes to talk with you today. What is one or two things concerning you about your health that I can help you address? And let's tackle that as a team." And like really that agenda setting. And that's really hard to do as a student, but it saves you so much time going forward, especially in family medicine when
Oh yeah.
um A lot of times you'll be walking out the door. By the way, doc, I forgot to tell you about this chest pain. You have to address that at the beginning.
Right,
So one or two things, or maybe three that you want to address, whether that be your heart, maybe your diabetes, maybe you're concerned about your depression, and you address that. And then the beauty of family medicine is you have continuity. You can bring them back. And that's
right.
what's really wonderful about family medicine.
Yeah. So if you guys haven't figured it out by now, our next episode is going to be about the family medicine rotation. So we'll be excited to do that one for you guys. But I think this was a really good short check-in. Anything else, Noah, you want to bring up before we wrap it up?
No, I think we covered a lot about what it's like to be midway through our third years, almost about to be fourth years in doctors, as scary as that is. But we got this. We're doing well. We're having a fun time. We're surviving. Maybe we're not thriving, but we're surviving.
Nah, we're thriving. We got this. All right. Well, thanks everyone for taking a listen to the Doctor and Duo podcast. We'll be back with another episode soon, maybe in the next month or two. We'll see how my OB rotation goes. But until then, take care. If you like what you see or hear, depending on the platform you're on, make sure to drop us a like and subscribe or follow, and we'll be back with more content. Thanks, everyone.
Yeah, see you guys.